Hi there. In this quick video, I just want to go over some of the things that I would use personally when I was working in an acute care setting, such as the hospital, something that you might want to use as a nursing student or a new nurse. You're not too sure what you should have in your pockets or what you should have as a resource. So if you're interested in that, continue watching. I'm not too sure how much I spent on this. It's been a while. I actually bought this during nursing school, but it's a pretty cool little clipboard, easy to clean. You can wipe it off with a sanitizing wipe when you leave the clinical site or in between rooms, depending if it's an isolation room. But I really enjoyed it. It's a nursing edition, so it has, you know, your Chem 7, your CBC, your LFTs as a reference of how some people like to write this on their brain. That's kind of how they document those. I personally never used it for that, but it's just a good guide to have, like, if you're thinking, okay, I'm looking at their ABG results, and what does that mean again? Rome, respiratory opposite, metabolic equal. Well, here's a guide right here, right? And this also shows the different gauges for IV use. So if it's like a 16 gauge, an 18 gauge, 20 gauge, 22 or higher, kind of gives you an idea of what you would be using that for. For example, like an 18 gauge would be for surgery, 20 gauges are like your routine, 22 is more like the small fragile veins. Anyways, I just thought this was a really cool guide. Also shows you different landmarks, IM injections, pupil sizes, and on the back here, or front, back, whatever you, on the other side, it kind of just goes over different volumes, different conversions, also a quick guide for temps. So say you're taking a temp in Celsius and you're like, wait, what is that in Fahrenheit? So this is a cool guide here, kind of gives you that information. Also weight and height in terms of like pounds and kilogram conversions. I personally worked on a med-surg Tele floor, and so this came in handy when it talks about the QRS complex. It also talks about a Q wave, ST elevation, T wave changes, and just kind of what to look out for. And then down here, it also goes over the sepsis or Shears criteria, and then it also has like the pain scale. Say if you're like on a pediatric unit, they're not able to tell you, 0 to 10. They can use the you can use the FACES scale. So I really enjoyed this. I think it's actually called a whitecoatclipboards.com. So there's that information. This definitely came in handy. I would always have it. And then if for some reason I had to run into a patient's room, or, I wanted to make sure I was not violating HIPAA, if I had my brain or my paperwork here, I would always flip it down or close it, and nobody could pass by and see patient information. Also, another good thing to have when going to clinicals or being a new nurse is a stethoscope. Mine I've had since nursing school. It's a 3M Littman Classic 2 SE. I don't know. It worked fine for me through nursing school, and it worked well for me when I worked on my floor. So good stethoscope. I also had Shears, scissors, whatever you want to call them. I always had them in my right hand pocket, so I knew if I needed them to open up a med or open up a package, they were easily accessible. Also, some people like to clip them, like on their scrubs or something. Pens. I love the Pilot G207. I think it's 7 point. Anyways, these are my favorite clicky pens. I would always have a blue one, or black one, or a blue one to write, like when I'm filling out my brain, when I'm getting report, when I'm having the patient sign consent. You always need to have a blue or black pen. This I loved because it was clicky, and also the gel just writes really smooth. And then I'm like, I guess, type A personality. I like to do like checklists or like to-do lists. And so as I was passing meds or as I was going about my tasks, as I completed those tasks, I would use my red pen and scratch it out or cross it out. And that kind of visually helped me see that I've been keeping myself on task and completing those tasks. So a blue and a red Pilot pen. I would always have a expo marker with me. We, at my hospital, had boards that we would write our name, who the charge nurse was, who the doctor was for that day, patient, preferences, the plan for the day. And so it's just good to have an expo marker so that you can write down information like that, or also write down family information, family phone numbers and whatnot. So expo marker. And then last but not least, a good Sharpie or permanent marker. Just having a good marker to write on, you know, my labels for my IV fluids, or say I just provided wound care and I wanted to label my date, time, and initials, things like that. So I'd always have these kind of things with me. I mean, everyone's a little different. Like I said, I worked on a med tele floor, so my patient care was a little different, but those are some good things that I use. Just some tips and tricks for you, either as a new nurse or as a nursing student. If you think of anything that's cool, that's worked for you, let me know. Although I don't work at the acute care setting anymore, I still use my favorite clicky pen when grading papers or, you know, checking students off on their skills and stuff. So those are my favorite kind of items that I use personally when working on the floor, when providing patient care, and I hope this helps.